Okay, hi everybody. I've put it together your um, SOAP note presentation. It's going to be very brief and to the point. I just want to go over a few things with you so you can get a clear understanding as to, number one, why we do these and in particular order. Now, many EMRs today, the electronic medical records that are out there, will dictate the order that you do things. Very few people are handwriting these things any longer, so gratefully it makes it a little easier for us all, but there are certain components that you need to know. SOAP note, putting one together, has a couple of important pieces to it. Number one, we need to ensure that all of the components are necessary for our coding so that we can get reimbursed appropriately. It ensures that we are not underbilling or overbilling for the services that we provide. And secondly, it ensures that we have all of the information present to justify our diagnosis and also to protect us if any of our cases ever went to a court of law. So with our SOAP note, we begin with the subjective portion of it, the SOAP. And in the subjective portion, that's what the patient is telling us. It starts out with a CC, the chief complaint. And the chief complaint is one or two words that describes why the patient is coming to the office today. Whether it's her annual gynae visit, a 8-month prenatal check, a urgency or burning with urination, vaginal drainage or discharge. That's it. You're not going to put any more information in the CC. You're going to elaborate in the HPI. The HPI tells your story. So your HPI is going to say, well, let's use a UTI as an example. Patient presents with urgency and burning of urination for the last 3 days. She has tried Urostat over-the-counter antispasmodic without any relief. States that she's urinating twice an hour with scant amount, foul-smelling odor to her urine. Last urinary tract infection 3 years ago. Denies our last intercourse was, because intercourse can cause UTIs. States that she urinated following intercourse, or stated that she hasn't been drinking as much fluid as normal, has been holding her urine for excessive periods of time. So the HPI is going to elaborate the information that we've gotten from the CC to build our case. Next, we're going to go into medications. What kind of medication does the patient take, if any? And I want to know if she takes vitamins, if she takes any herbals, probiotics, anything. I want to know and have that in the medical record. Allergies. Does she have any allergies to medicine or food or latex? Those things are all important too. The next one is going to be past medical history. And I want to know all about her past medical history. Does she have any issues with her thyroid, hypertension, hyperlipidemia, diabetes, lupus, arthritis, anything that she has? It's important. It's not restricted just to her reproductive health in this setting. It's the whole kit and caboodle. Then I want to know if she's had any surgery. So, past surgical history. Tonsils, adenoids, foot surgery. Sometimes people forget. And I want to know her family history. And sometimes you need to prompt people on this. Do you have anything that runs in the family health-wise, like high blood pressure, diabetes, cancer? If they say yes to cancer, I want to know what types of cancer runs in the family. And I want to know if it was breast cancer, was it on the mother's side or the father's side? Makes a big difference. I also want to know what her immunization status is. Are her immunizations up to date? When was her last tetanus shot? As nurse practitioners, it's important for us to ensure that we are getting our patients vaccinated. The next is, because we're doing reproductive medicine now, it's important to know what her reproductive history is. Is she a Gravida 1, Para 1? Did she deliver vaginally? Were there any risks or complications in previous pregnancies? Um, how many sexual partners has she had? Is she in a heterosexual relationship? Is she, let's see what else, anything that has to deal with reproduction. Has she ever had an STD? Things like that are going to go here. Next is our social history. And for a first-time patient, these things can take a long time to build. So with our social history, I want to know if she smokes. Any alcohol use? And if so, how many drinks per week? Any drug use? And you'd be surprised how many people will tell you, yes, that they do use drugs. Now, I also want to know, does she exercise? And if so, what does she do? I'm going to ask her about her diet. What kind of diet? Does she eat a lot of processed food? And is she married with children? Does she live in a single family household? Whoops. What kind of work does she do? All of these things are important pieces to the S. The next piece of this is going to be your review of system. Whoops. Your review of system. Oh, it's not going to let me put it here because I've gone over my lines. So, I'll start over again. Review of systems. And with the review of systems, you're going down each system. But there is something that you can do. It's a little trick of the trade. You can write in here negative, except for those stated in the HPI. So that saves you a little bit of time. So that is your S. And I'm going to get rid of this and change my color here. And so we're going to go to the O. The O is the objective. And it usually starts out with vital signs, including height, weight, BMI. If she's pregnant, I want to know how much weight she's gained during this pregnancy. Where are we at here for weight gain in pregnancy? I also want to know fetal heart tones, or if she is at that stage where she's getting NSTs. Did she get an NST in the office? Was it reactive? And what's the fundal height? Whoops. If you're doing a cervical exam, what was her cervical status, or VE for vag exam? And that could be like, say, 1 centimeter, 80% effaced, -1 station. That's if she's pregnant. Now, the patient we're using now is not pregnant. Or the one we're doing is a UTI, but just in case she's doing that. Okay? Then you're going to go over your systems. And this is your physical exam. And on this one, you do need to go through all of your systems. But you only have to comment on the ones that are pertinent. So your CC dictates your HPI, and your HPI dictates your review of systems, and your review of systems dictates your physical. So anything that you have made notice of in your review of systems must be documented in the physical portion. So for our patient, we definitely would, and you also have to have a minimum of 3 areas documented on. So I always start off with, patient is alert and oriented, appears healthy. And then I would write, you have to make comment on her bladder status or back pain. So at least 3. So a minimum of 3 systems. And that's a coding issue. And you can go as in-depth as you like. Many of you are going through each system and either saying negative or non-contributory, and that's fine. You can keep doing it that way if you like. That's not an issue. Alright, so I'm going to get rid of this one. change my color, and then we're going to go to A, which is the assessment portion. So the assessment portion is going to tell you what your physical findings are, and you're going to list your differential diagnoses here. With your differentials, you're going to have at least 3, minimum of 3. And you're going to add your ICD-10 codes to those. You're also going to come up with your ultimate diagnosis with your ICD-10 code to that also. And then we've got your plan. The plan. Any medications you're prescribing goes in the plan. What's your treatment plan? Meds. And I want to know what they are, how you're going to not just say amoxicillin or macrobid. You need to tell me what the dosage is. So write it like you're writing a prescription. I think that's something I really didn't get when I was in FNP school. And then I was out and I struggled a little bit with writing prescriptions. So I want you to write it just like you're writing a prescription. Any tests that are going to be done, I want you to do that. And a big portion, which I see lacking, is patient education. I really want you to go into this one and tell me about patient education. What are you telling that patient? If you want to add patient education sheets to your SOAP notes, I think that's a great idea. I do that in my documentation all the time. What are you instructing that patient to do, too? So let's say if this patient is a bladder infection patient, I am going to, I prescribe macrobid, 100 milligram tablets, or they're capsules actually. 1 cap BID times 7 days. Okay. Then I'm going to instruct the patient to take medication as prescribed, increase fluids, don't hold her urine, make sure you avoid following intercourse, wipe from the front to the back, and anything that she should know to help reduce her symptoms. Cranberry juice is okay. It has an antiseptic property to it. It's the pushing of the fluids which helps a great deal in this particular case. And call me in 24 to 36 hours if there's no improvement in your symptoms. And with these patients, I would have a urine dip. That's going to be up here because I'm doing point of care testing, so that's would be part of my assessment. Dipstick, urine, and then I want to know what the dipstick reading was. And then over here, and then for my tests, I always do a urine culture. So that I can determine exactly what the bacteria is, and I can determine if the medication is going to kill that bacteria, and I also can see if it is a bacteria at all, because sometimes it's not. There is a gynae issue related to that. So just a few minutes to give you a little greater understanding about SOAP notes, and I hope that this helps. Please let me know any feedback or any added information or teaching opportunities you'd like me to do. Let me know. I'd be happy to do so. So have a good